Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to our Monday's Q&As. This is a place where I answer your direct and specific questions as long as they can be generalized to everybody else and are not diagnostic in nature. So if you have a question, please don't hesitate to leave it in the comment section below or email it directly to me at info@drzphd.com and I'll make sure to include it in the Q&A folder. I want to first thank everybody who has been posting questions because it seems to be the Monday's Q&As is so far one of the favored for a lot of you. And I can see why. I love myself seeing people who are focusing on a particular field to also do Q&As because sometimes the question that somebody else asks is exactly the answer that I myself need to hear. So I can completely understand how this is very helpful to a lot of you. And I very much enjoy making this Q&As. As always, I have picked out a random 6 questions for today, and I have blocked out everybody's name for privacy reasons. So let's get going. There's going to be timestamps as always if you want to jump around. So the question number 1 for today. Hello, Dr. C. Thank you for your videos and what you're doing for the trans community, especially during this dark period and anti-trans hatred. It is my pleasure to create at least some form of a space for all of you to feel like you're being seen and at least somehow represented through my platform, and at least to give you some clarity and insight into what's going on. It's absolutely is. It's really my life path, to be honest. On a more positive note, I'd like to bring up the subject of the euphoria we feel when correctly gendered. However, cis persons are correctly gendered more of the time, and I don't think they feel euphoric every time this happens to them. Could it be that cis persons are used to it? If so, would our euphoric feelings taper off over time? It's a pity if that is so, since it's such an invigorating and validating feeling and always brightens up my day. So this is a really good question. So it has multiple aspects to it. One, do cis people feel euphoria when they're gendered properly? I would venture to guess that they do not. Speaking, at least from my experience as a cis-identified person, I don't even pay attention when I get gendered at all, to be honest. And I think the reason why me and a lot of other cis folks don't really notice it is because we don't experience incongruency and therefore don't experience dysphoria. I always say that there has to be some form of polarity in order to feel one. You need to have experienced polar opposite too. And for a lot of you guys out there who are experiencing euphoria when you're probably being gendered, when you're probably being seen, what happens is the reason why you feel euphoria is because there's also a presence of dysphoria. It is the presence of dysphoria on one pole end that enables you to feel euphoria when you feel like things are felt right and congruent to who you are. And because cis folks don't really feel dysphoria, at least in relationship to core gender root, and I think a lot, to be honest, this is speaking for myself, they can take gender for granted and just don't think about it. But to answer it, first of all, it's incredible, if not incredible, but let me rephrase it. It is, I think, very reaffirming for a lot of you who do experience euphoria. And euphoria is there also as a form of an experience, a form of factual experience within your subjectivity that also tells you that you are on the right path, or also reaffirms that you are stepping in the right shoes. Will that taper off over time? In my experience, with clients I work with, yes, it does taper off. I know you feel like it's a sad thing because it's invigorating and validating, but I don't want you to feel sad because tapering off of euphoria is a great symbolizer that there's also tapering off dysphoria. And it's also a great symbolizer that you are really living your life and you're now really fully embedded in your authenticity. And you're so connected to yourself that you don't even need euphoric feelings to any longer validate those experiences for you. So don't look at it as a sad, look at it as actually a really good step toward you really encompassing and really being within your own authentic self. But yes, in my experience with people, it does taper off. Once you get really, really one with your authentic gender, you notice that less and less because guess what? You at that point very confident and comfortable about who you are and how you navigate this world, and therefore you don't need those feelings sad to make you feel validated or feel good, and you notice it last. Comment below if anybody feel like there are feelings of that have not tapered off. I bet there's some people for whom it doesn't taper off. It's just in my experience, I see it by far tends to taper off for a lot of individuals. But great question, and I agree, it is very validating and invigorating feeling when that happens. When we're being seen, that means we exist, and that's wonderful. Question number 2. Hello, Dr. Z. I'm a trans woman working in mainly female workplace, and I struggle with dressing and socially being there because I think it makes them uncomfortable, and my state has the right to fire for any reason. So my question is, do you have any suggestions navigating the environment? Should I just dress in styles or just commit my identity and risk losing my income? Anything would help with this. This is a tough question because I can just feel how frustrating and tough your situation is. It's also a tough question because so many other people are finding themselves in exactly the same environment. First foremost, when it comes to stepping into who you are, is safety. Safety, I always say, is first and foremost. And sometimes we have to forego being who we are in order to preserve our safety. And that's a painful and difficult choice that cis people can't even fathom or wrap their hands around because they never had to experience that. Having said that, I'm not just talking about physical safety. I'm also talking about safety to your essential livelihood, such as being able to have shelter over your head, to be able to put food on the table. Those things are incredibly essential to our safety. So for that reason, I can't, and I would not recommend risk losing your income and then ending up in a much more strenuous position. I just would recommend for you to think about your safety first. Having said that, for people who find themselves in work environment where they feel like it makes others uncomfortable, my first question is this truly makes others uncomfortable, or is this something you assume is going to happen if you're going to actually own who you are? 1. 2, if people do want to actually show up as yourself at work, my recommendation is always go to HR department. HR is supposed to keep the conversation between you and them confidential. And 2, it will give you a good idea through HR what the work environment is like and whether it is a safe space to come out and to own who you are. That's what I would recommend. It's a tough thing. I don't have a clear answer for you because this is a tough decision that a lot of you have to face, not just this person who posed this question. But safety is always, always first. And right now, safety is even more important for so many of you because of what's going on in the world. So it's a tough question. I'm sorry I don't have a clear answer for you. But this is the best that I can offer. And I really wish you all the best because being in a situation where you potentially can lose your job just by sheer fact of being who you are is horrific. Question number 3. I'm 29 years old, trans femme person, pre-everything. I have a question about the nature of the gender, whether it is inner sense of yourself, which doesn't depend on what people say, or socially determined construct. The case is the following. My wife refuses to use she, they pronouns and my female name with me. She points that if I think I'm a woman, I can present that way and shouldn't care about her or other people's opinion. She treats me as her husband with male name and pronouns. I don't agree with her. Gender is a social construct, and it exists when it is respected by other people. That is why using correct pronouns with trans people is very important in affirmation their gender. For me personally, it's very, very hard for me to use gender-specific vocabulary about myself when other people treat me like a man. I totally agree with you. It even makes me doubt about whether I'm trans or not. What are your thoughts about this issue? So I'm going to share my thoughts about whether gender identity is an inner sense of self or whether it is a social construct. I want to be very clear with everybody that this is my opinion. It's an opinion that stems from my experience as a psychologist and as a psychologist working solely with transgender and non-binary adults, and an opinion also that is stemming from my exposure to a lot of literature by sociologists and feminists and historians on gender and understanding of gender, and also scientists and biologists on understanding of sex. What I'm trying to say, in other words, that this is my opinion that is clouded by all of those experiences. Some of you, in fact, I know that some of you have a different opinion about this. That is okay. My opinions are not all type of thing. It's not meant to be dogmatic. I'm only sharing what I learned and my understandings through my lens, and it doesn't make my lens the truth. So keep that in mind. Having said that, when people ask me whether gender is an inner sense of self or social construct, and then I know that people on the other side like to point out that if it's a social construct, why should you give a shit about pronouns, and why should you give a shit about other people validating you? Gender identity is, first and foremost, it is an inner sense of self. It's your inner sense of how you see yourself in relationship to gender. However, the inner sense of self doesn't just develop internally, because you don't exist in a vacuum. None of us do. The minute we're born, and let's say you're born with innate sense of self, the minute you're born, you're being put into pink or blue, unless your parents are progressive and they're putting you in neutrals. But most likely it's pink or blue. The minute you're born, you're being gendered, boy or girl. The minute you're born, the toys that are being bought to you by parents and by family, friends, and relatives are also being gendered. What I'm trying to say is that you're also born into the world around you. And within that world, there's also gender perceptions and constructs which are absolutely exist and are humanly created. We're not talking about sex. Sex, in my opinion, is not a construct. Sex is a way we denote the variability within human species. What I don't agree with is when we take sex and then we anchor it to gender, which then is absolutely construct. How we also see sex beyond actual biological facts, which if you look at the biological facts, there's a tremendous variability between different sexes, tremendous variability. But how we also layer and construct the idea of sex as male sex is this, this, and this, and female sex is this, this, and this, are also constructs. When you're born and you live and exist in the world, within your cultural context, you're bound to be affected by those constructs. Therefore, your inner sense of self is going to be twofold: an internal sense of self and an external sense of self. And that external sense of self is inadvertently going to also affect your internal sense of self. It just, in my opinion, they cannot be divorced from each other because we are bound to be, to some extent, affected by the culture, the society, and the historical contextual times that we're born into. It is just the way it is, in my opinion. Therefore, gender is much more complicated, you see. So it is both. It is in itself, but the constructs of gender that existed throughout time are definitely going to influence that perception of self. And this is why also it is so important to be validated when people say, why do you need your pronouns if it's all constructs? Well, we're still human individuals who having a human experience within constructed paradigms and patterns of the world, whether it is right or wrong. It just is. It's almost like a blueprint to navigate the world. And in order to feel seen and represented, we need that. That's what I think about. That's my opinion. And, I'm sorry that your wife, your partner is not being supportive, and she's using all pronouns. And I understand how it even makes you doubt yourself. And this is the problem. I think pronouns, in my opinion, is the most easiest accommodation any other person um, can really engage in. It's not difficult. Even if people strongly have a view that transgender individuals, whatever they have their view about transgender folks, it's keep your views. Nobody's asking you to change your views. I think the pronouns is basic human decency. So yeah, this is my opinion on that. You're bound to be influenced by constructs, I think. But I would love to hear what other people think. So please comment below. If you disagree, completely valid. I'm all up for Discord, and share what are your thoughts on this, and what are your thoughts on what you think about it. But I think that, at least for me in my lifetime, my relationship to my gender, and it has been heavily influenced by constructs for sure. And there's some constructs on what it is to be a woman that I have to constantly chip away, because I realize that they're socially enforced and they are no longer are in alignment with myself as a human being first and foremost. But really, really good question, and thank you for asking that. So hopefully this helps. Question number 4. Hi, Dr. Z. Thanks as always for your wonderful work. You're very, very welcome. I have a question which I don't know if you have discussed in some of your videos, but have you ever seen for yourself the consequences of not dealing with gender dysphoria or not transitioning when someone actually accepts their trans? Maybe people come to you to get support for long-term coping, or maybe there's some study regarding this topic. I don't know. The web is flooded with testimonials from people saying, do it now or your life will be hell and you'll regret later on. But out of logic, transition is a modern phenomenon. As a solution for gender nonconformity, and you have yourself said that choosing not to transition is a valid option. It is absolutely a valid option. And apparently there are folks out there who manage to high function who manage to high function in that setting. So I wonder, what are usually the outcomes of such discussion? Thanks in advance. What an important and really good question. So I work with a lot of people, and people come to me usually for it's 3 things. It's one, to clarify and confirm that they're struggling with gender dysphoria as stemming from gender identity root cause. 2, people who do know they're trans or non-binary and they're seeking a plan. They want me to help them outline within their circumstances in life, transition plan, and to discuss and explore what that would look like for them within the scope of not only the dysphoria that they feel, but also within the scope of their resources. And within that, also people come to me knowing that they're trans and also want to explore whether it's worth it for them to transition, whether they just keep going on and living with gender dysphoria. And then the third group of individuals are people who like to work with me as they're going through gender transition, as a guide, as somebody who supports them, as somebody that helps them navigate the waters. So this falls within the second group of individuals that I see a lot of. And I see a lot of individuals, age 45 and up, that have always, well, a lot of times, it's the same concern. Is this worth it for me right now? A lot of times these individuals have families, have kids, have careers. Like I always say, they have an ecosystem around them. And therefore, it becomes very, very scary and overwhelming to consider that might be challenged and changed as a result of transition goals. I have now seen a number of people who decided not to go through gender transition. Are these people doing fine? Yes. Did dysphoria go away? I'm going to be honest with you. No. Did dysphoria get worse? This is where we fall into subjectivity. Not deciding to transition, if this is not for you, again, transition is not for everybody, but deciding to just continue to live your life and cope with it is a deeply, deeply subjective decision that depends on numerous factors. 1, it depends on your coping capacities. 2, the severity of your dysphoria. Some people have lesser severe dysphoria, and therefore, they don't need a very elaborate coping mechanism in order to deal with it. So it's there's a lot of things happening there. And when people come to me and they tell me, can you tell me if my dysphoria is going to get worse? My answer is the same. And it's for all of you watching this. Nobody is going to ever guarantee the dysphoria is going to get worse, or the dysphoria is going to suddenly go away, or that's going to get better. You're a human being, you're multidimensional, you're multidynamic. There's a lot of aspects to you. Sometimes you may be coping with dysphoria really, really well, and then suddenly something in your life happens. A loss of a loved one, a loss of a job, something that's very drastic and very different, and suddenly you can't cope anymore. For that reason, nobody has a crystal ball. So when people say do it now, or your life will be how, you have to be careful that they are talking about their experiences. For them, that was worth doing it. So we have to be careful when we part our advice. When people part their advice, they have to be careful because they're really projecting their experience. So you gotta keep it in that context. Deciding to go through transition is not easy. When you have an ecosystem around you, it is very challenging to make the decision. But it is possible, and that depends on many factors. Deciding not to go through transition and to continue to live and cope with dysphoria is also possible. People do it. I wouldn't say that gender transition is a modern phenomenon. We've had it for longer than our current times, but definitely it's definitely much more prevalent and much more, I would say, accessible today than ever before. So yes, you have to also think about all of the people before gender affirming care even existed. And how did they cope with it? I mean, they lived, right? They lived their life. And sometimes you also have to consider this. This is important one, and a really important one to think about. When you live in a historical time period, when there is absolutely no gender affirming care, knowing intellectually there's no possibility at all, is in of itself can ease and help cope with gender dysphoria, because part of your brain at least knows, well, there's absolutely no outlet. There's just no outlet at all. There's just nothing you can do about it. It's analogous to being born with, or I don't know, God forbid, have an accident and lose a part of a body, and you can't replace it. Living in time and you cannot replace it. You just have to find a way to cope with it. Sometimes having absolutely no outlet is an outlet in of itself. So keep in mind, all of you today are living in a time history where gender affirming care is, it exists, it's possible. There's also a lot of people talking about gender affirming care in the field, good or bad. And there's also way more people who are sharing the stories, how it has affected them. Your brain already knows there is a possibility. And this, I'm going to be honest with you, make it that much more difficult for all of you. When our brains know there's a possibility, and there's also part of you that maybe wants to consider possibility, that creates tremendous amount of tension. That's what tears a lot of you apart right now, because it's like, oh shit, this can happen. A lot of you realizing this is possible even later in your life, and you're starting to think, is it worth it? So that makes it that much more difficult. There's no way to say whether living with dysphoria and coping is the best way to go. It's not the best way to go. It's just another option, and people do it, and people have done it, and people continue to do it. But to decide to do it is deeply, deeply subjective and depends on numerous factors in your life. So that's what I gotta say. It's a tough question to answer, because I know that so many of you are grappling with those questions, grappling with the decision, grappling with being inundated today with so much gender stuff in your face. It's difficult not to start thinking about your situation and what you can do about it. So I really wish all of you the best who are in that position. And it's a really good and important question to ask. Question number 5. Dear Dr. Z, many thanks for clearing and bringing a better understanding to many questions I had via your Q&A sessions and numerous other videos on the subject. My pleasure. Question: I have been on hormones for about 8 years now. I love things feminine and adore female beauty. Desire to be female and accompanying dysphoria over some years drove me to male to female transformation somewhat later in life, 50s. Never too late. I have been on male to female hormones in secret. Coming out has not been an option for me, given the risks. Understandably, any related surgery may likely reveal the female in me and has not been pursued yet. So here's an example of a person who's on hormones, but has not been, sounds like has not been really out or taken other steps that they may even want. Nonetheless, I have been expressing my female self often and in public when the opportunity permits or it is safe to do so. This has provided a meaningful measure of fulfillment and satisfaction and some appreciation, appreciative looks, and even approaches from males. Given my circumstances, I have feminized as much as I can, at least at least to breast development, and I'm fortunate to be slim and tall. Does it make sense to continue with hormones, as physically I doubt that I could feminize much more? Or is there an ongoing psychological benefit to dysphoria of being on hormones? Is it worth it, the going to expensive hormones at this juncture? Looking forward to your Q&A sessions. And should you select the response to my question? Great question. Let me just take a sip of water because I think I'm coming down with something virus or cold. My throat has been very hoarse lately. This is a great question. And this is a great question because it kind of segues into the question that was just asked about coping. So here's an example: individual in their 50s on hormones for 8 years. Sometimes when safety permits, they will feminize and embody who they are. Other times there's pretty much out, I mean, not out and not really fully presenting as female. And they're wondering at this point, will hormones do any more physical changes to the body? And is there any psychological benefits to hormones? This is what I gotta say. If hormones make you feel better and help you with dysphoria, then hormones are helping psychologically. You can absolutely go off hormones and see what happens. A lot of times in my experience, people go off hormones because a lot of times they freak out that the change is happening or whatnot, and then they go off hormones, and what happens is dysphoria comes back, and it comes back twofold. It comes back even stronger than before. And it's deeply uncomfortable, but for a lot of people, going off hormones is a necessary step to reaffirm for them that they are really, truly transgender. Another thing with going off hormones is that body starts masculinizing again because your body reverts back to producing testosterone, and people don't like that as well. So you can try if you really want to try going off, and although I don't recommend it because it's overwhelming. So excuse me, my opinion is that if hormones are helping you and psychologically putting you at ease and giving you that peace of mind, why not stay on hormones? My question to you is if you stayed on them for 8 years, why not stay for them until indefinitely? Why would that be an issue? Is there a concern staying on hormones for this long? Did your body feminize to its fullest? I don't know. Everybody feminizes very differently. It depends how your body metabolizes hormone. It also depends whether you're able to change. There's something, I know this is anecdotal, but oh my God, the number of people I have heard tell me that this works. When you've been taking hormones, let's say through orally, and then a year or two, you switch to injections, and then you switch to something else. It's amazing how it tends to spike up additional growth in different body parts. I think there's something about switching up the route of administration where that helps body to be more receptive. I know it's anecdotal, but oh my God, the number of cases I heard people say, it's just numerous. So I definitely think that the hormones do psychologically a tremendous amount of well-being. For the people who, and the question that was before, for people who are asking about coping, when people come to me and they say, I don't feel like it's worth it in my life right now to go through transition, and I go, okay, this is valid. This is valid assessment of your situation. Then I ask people, would it be possible to go at least on a low dose of hormones and see first, try out and see if it's going to alleviate some of the psychological distress of dysphoria. And depending on the person and their circumstances and their situation, they try it out. And if it works, that's something that people do. And sometimes people not able to even try that because they're in relationships and they're concerned about sex drive declining, and they're concerned about other things, and that's also valid. But do consider, for people who are thinking about coping long term, if it's possible to try hormones and see if they're going to help psychologically alleviate distress. Great question. So yeah, if they've been helping, I don't understand why go off hormones if they've been helping to alleviate stuff. Final question for today, question number 6. Question: I have a 6-year-old boy. How do I transition without creating a conflict in him or giving him the feeling that he's losing his dad? So it is the font small. His male role model, which he loves and admires so much. My ex says he does not need 2 mothers and fears that my transitioning will make him want to transition later. She's not supportive of my transition because I am one of those you spoke of who just dove into my desire to transition very recently and very quickly, and it scared her, making her question my sanity and not trust me with our son. Oh, I'm so sorry. I'm also concerned about how to honor my need to transition in a timely yet gradual manner without overwhelming or confusing my son. I do not know how or when to discuss this with him. It's all at all. By the time he stands his father, I may no longer look like and act like the dad he knows, as I may have breast and vagina and look and sound like a female. That may be very strange and disconcerting to him, and I'm afraid that he gets teased and bullied by other kids in our small town. How to wisely and harmoniously navigate being transparent? What an important question for everybody that have kids. I'm going to give some feedback and then some suggestions. First of all, it's difficult to be harmonious and navigate your life when your ex is against having 2 mommies. I don't see why there's a problem having 2 females, 2 women in a boy's life, honestly. The same gender couples raise fucking fantastic kids. So I don't see the problem with that. And I have a lot of couples who do just that. And it's hard to be harmonious when she's afraid that it's going to somehow brainwash or environmentally influence the boy, where the boy will want to transition, which I work with adults. I have yet to see adults who were brainwashed because their parent transitioned when they were a child. So it's hard to be harmonious. In other words, when your spouse is I have a feeling very resistant, has a hard time dealing already with the situation. When it comes to kids, the younger they are, the better they are to adjust. It's amazing how kids adjust and adapt. And anybody who watching it who came out to their kids of similar age will probably attest to just that. It is often the older the kids are, the harder it is for them to adjust. So if you have kids who are in their late 20s, 30s, 40s, some of some of you kids may have had a harder time adjusting, which is really sad. But kids do have a tremendous capacity to adjust and be resilient. And I always think that being an authentic parent teaches kids to be authentic themselves and to own who you are in this world, which is the biggest lesson and wisdom we can impart to children, to really be and own who you are in this world and not be afraid. So it's challenging because you have so many factors. You have partners that feels resistant. You yourself seem to be starting to be very concerned about your son, but at the same time, you are transitioning. What's important, I think, is first and foremost for you to also find your pace, for you to also figure out what you need and what it all means to you. And it sounds like if that's going to happen and that's inevitable and that's in the plans for you, then it's important and inevitable to tell the son, because he will be changing and he will be experiencing these changes. And it's better to be clear and transparent than a kid to start making assumptions. What I would suggest and recommend is couples or family therapy, if possible, to discuss how to set that plan in motion, to discuss what that would look like for all the parties involved, and to find something that will work for all of you involved. That's what I really, really would recommend. When people ask me what is the best way to come out to your kids, I always say there is no best time or way, there is just a way. You sit down with them, you talk in a language they can understand, and you just share with them what's happening. It's analogous to sharing anything else big in your lives. When parents go through divorce, they sit down and they tell the kids too, and they find language, and it is just like that. We really have to teach young kids too. How to sit with uncomfortable and unknown and confusing things, and that's what parenting is there for you to guide your child through the times. So I think the concern that other kids are going to bully is present for many of the trans parents of younger kids, especially in today's society and culture. And that's something also for you to navigate. So it's really complex question. I just offered you some of my personal reflections and thoughts on it, and also suggestion. I really do think that a family therapist would be very helpful in this case to set out and work out on a plan that you and UX can all agree with. Um, I would really encourage anybody else that came out to younger kids, share in the comment section and give this person feedback, how this worked out. What are your suggestions? I'm really non-believer in a mindset that parents coming out when kids young is going to ruin the kids. It's going to brainwash them. It's going to mess them up. It's going to traumatize them. I'm really, really not a believer in that. I think that's bullshit. You're a loving parent, and you're also an individual that is going through something that is very important in your life. What traumatizes kids are parents who are neglectful, abusive, toxic, are not present for them, don't create space to listen to the kids' feelings, don't create space to talk to them and to understand what's going on in their world. That creates trauma. But being who you are and being transparent and honest with your kids, I don't think it's traumatic. I think I think it's just life. And I think it's being a parent that is going through transition with a 6-year-old. That's what I think. But again, this is just my opinion. So recommend for you some of those things. And I hope others will comment and share down below as well their thoughts. And other than that, comment below. Let me know what your thoughts are on some of those questions. And feel free to post your questions in the comment section or email them to me at info@drzphd.com. And I will see you all next time. Have a great day.